What would happen, Ramona, at your facility when a woman would call or come in who was pregnant, who was looking for pregnancy-related services?
There was nothing to offer these women. Many times I felt that I couldn't help in the way that I wanted to help. For example, prenatal care. There was no prenatal care. There was nothing that we could offer women who were pregnant. There was nothing that we could offer for women seeking fertility treatments or who were trying to conceive. Again, that's the idea. You go in with the perception that Planned Parenthood is there to help women in any situation, not just when they're wanting an abortion. You think gynecological services. You think affordable, health care for low-income women, non-insured women. So I really went in believing we're just like a gynecologist. Then you realize as time goes by that you're not.
As a manager of the facility and going in with that kind of thought of, oh, I can help women with these health needs, how did that make you feel when you would have to say to these different women, no, I can't help with that?
I think disillusioned is the perfect word. I've always had this really strong desire to help people who are struggling. And that's really the mantra of Planned Parenthood, isn't it? To help women and to provide these services for women. And where are they going to go if Planned Parenthood doesn't exist, right? And so as you're going through your day-to-day routine and realizing that these women are encountering real problems that really you can't help because everything is limited to contraception and abortion.
Did you get calls from people seeking services related to pregnancy, like prenatal care, and what would you tell them?
We would have women even women that would come in and they'd have, say, a breast lump. Well, there was nothing we could do about that. We'd have to refer them out. Or an abnormal pap smear, anything like that. We didn't do mammograms. There was the whole mammogram flap where, Cecile Richards was saying, thousands of women are going to lose their access to mammograms. Well, there's not a Planned Parenthood in the country that's ever done a mammogram. But that's just one example of something that they say they do to help women, but they've never ever done that. And same with, prenatal care and adoption and, all these things that women need. And of course, the reason that adoption and prenatal care weren't hit hard is there's no money in that. They made their money if somebody had an abortion at a Planned Parenthood facility.
And so no prenatal care quota?
No.
No adoption quota?
Nope. Only abortion.
Only abortion.